One of the biggest insults to our U.S. veteran community is the fact that we're seeing other countries that are not only willing to provide legal access to veterans, but are willing to fully subsidize the cost of their medical cannabis. For instance, in Canada and in Israel, the federal government sponsors the cost of the cannabis for these vets because they realize that the existing literature is already compelling enough to warrant that. So even though the prohibitionists will say there's not enough science to justify the use of cannabis as medicine, but the fact is that there's thousands of controlled trials published in peer-reviewed journals confirming the medical benefits of cannabis for a variety of conditions. What's interesting is that Canada and Israel, that's not a new program. It's not like it just emerged. They've been doing this for over a decade now, and the sky hasn't fallen in either of those countries. Veterans are getting safe, legal access to lab-tested cannabis, and they're benefiting from it. And so I think veterans are just mystified at how these government officials can read the same literature and come up with different conclusions. And the U.S. government has not even provided a path for veterans to get legal access to cannabis. They still can't go talk to their VA physician, right? So the VA doctors, most of them refuse to even have a conversation about cannabis as a medicine. And if you dare admit that you're using cannabis in a VA system, you'll probably get terminated from your opioid programs. The treatment staff may be prejudiced against you in other ways as soon as you turn up with a positive urine. So even though the VA has created a directive on the national level to try to prevent VA hospitals from punishing patients who are using cannabis if they're in a medically legal state, but it doesn't matter. The VAs only inconsistently adhere to that policy. So it's easier for them to not even tangle with the system and just say, forget it, I'm just gonna work on my own treatment. And what's interesting, these guys aren't just doing cannabis. Once they start using cannabis and feeling healthy, then they're engaging in all kinds of other alternative treatments. They're doing meditation, they're doing yoga, they're finding relief from all kinds of other dimensions that they didn't know was available to them before because the VA didn't really expound on that at all.